The SIU Medicine Minute brought to you by SIU School of Medicine.
Today we're joined with Dr. Anshul Pandey. He is an associate professor here at SIU Medicine. Today we're here to discuss medical psychiatry and who would be in need of this type of psychiatry.
Well, medicine and psychiatry, it's a combined training, so it helps us provide both kinds of care when it comes to primary care or care in the hospitals for patients, along with psychiatric care both in the clinic and in the hospital.
And what are some of the common issues that you treat using medical psychiatry?
We'd be treating most of the stuff which you'd see in a psychiatric clinic, like depression, anxiety disorders, bipolar disorder, psychotic disorders, but the advantage of medicine psychiatry here is that you have one physician who is trained to do both, which is take care of the medical issues that come with chronic mental illnesses, and then the mental illnesses that come with chronic health issues like diabetes, hypertension, if someone has a neurological condition.
And what are some of those treatment options that are available for patients who are in need of medical psychiatry?
So we have a whole bunch of medications that we do prescribe. We monitor them with our labs, but then if medications aren't an option when it comes to treatment, then we also provide treatments like ECT or TMS, which are all available through our SIU Psychiatry division, and we're plugged in with them. So it helps us integrate care really well.
And what are some of the signs that a patient may need to seek treatment in terms of medical psychiatry?
It's a good model where if a patient has a lot of chronic physical health issues, a lot of patients who have neurological issues like Parkinson's disease or multiple sclerosis, a lot of those conditions come together with mental health conditions, mood disorders, but also other disorders. So having one physician who might be able to manage both of them together would be a good idea. Or when we have patients who have chronic mental health conditions, there's a huge overlap between heart disease, diabetes, blood pressure. So if one person can do both.
Absolutely. Well, Dr. Anshul Pandey, thank you so much for joining us to share more on the importance of medical psychiatry for today's edition of SIU Medical Minute.